Hi, everybody. Such a pleasure to have Dr. Alba Azola back with us. As you know, she's is a director of long COVID at John Hopkins and assistant professor in Department of Physical Medicine and Rehabilitation. We already had her on our open house, and she's back. I'm so excited because there is a new study that she's leading, and she's going to talk all about us. And we'll try to keep it short. So, Alba, welcome. And thanks so much for joining us. Right on to you. Tell
Yeah.
us this new study.
Thank you so much for having me. And yes, I'm very excited. I have partnered with the Department of Neurology, as well as infectious disease. This is a group that has been working on neuropsychiatric impairments post HIV. So they have a particular kind of protocol and techniques that they've been using. And we kind of cross-pollinated and decided to use some of those techniques in our long COVID population that is particularly presenting with neuropsychiatric sequelae. So,
Like that's like half of all the patients, if not more.
right, right, correct. There's a lot of them, and there's a lot of potential things contributing to the presence of neuropsychiatric sequelae, right?
Mhm.
In our particular study, we're going to be looking at the role of the disruption of the blood-brain barrier. And I know most of you are patients, and you may not know exactly what that means, but there's a special protection when the blood circulates in the brain to prevent migration of things that are hanging out in the blood and get into the brain and start revving up inflammation. So we believe that there's a disruption in the blood-brain barrier, and that is allowing perpetuating an inflammatory state by letting some of the cells from the immune system migrate into the brain and start releasing cytokines, for example. So basically, that's our hypothesis, and we want to know how much that is contributing. And the study, basically, it's going to be 2 visits, and 1 visit, you're going to have some blood work done. There will be a psychologist doing an extensive exam. We're mainly focusing on the cognitive aspects, as well as teasing out any depression or anxiety that's associated with the symptoms as well.
Mhm.
Then the second part, or the second visit, it's going to be an MRI study that has a specific protocol that allows us to see the significance, or like the amount, basically allows us to quantify the amount of disruption to this blood-brain barrier. And we want to compare patients that have long COVID with the symptoms to patients who had COVID but recovered and don't have any lingering neuropsychiatric
So
sequelae.
all the patients in the study had COVID at some point. So this
Correct. Yeah,
the
yeah,
control group is going to have no long COVID, and then the active group is the one.
yeah.
What blood tests are you going to use for the blood-brain barrier permeability?
So basically what we're getting is like routine blood work, and we're also partnering with immunology for them to have a specific testing of cytokines that are not usually commercially available, but that they will give us a bio footprint of what is circulating in these patients and compare that to the people that are not having the symptoms. So it'll also help us look at the biomarkers in this patient population, and if there's something that picks up some noise that is different from people that are not suffering from the symptoms.
Can you share what those inflammatory markers are?
Yeah, hold on. Actually, I would have to look at the protocol, but
So it's a kind of a combination of the lab test and MRI, if I understood
yeah,
correctly.
correct. Correct. So we're going to look at markers that promote mononuclear cells, so peripheral mononuclear cell trafficking or transferring into the brain. So CCL2, CXCL12, VEG, so VEGF, TNF alpha, IL-6,
Mhm.
CCL19, MIG, CXCL9.
That's a lot of tests.
The list is very extensive.
Very good.
Yeah,
And so patients don't pay for any of this. I just want to make sure that
absolutely not.
Right.
None of this is, these are for research purposes. And, again, I always like to reiterate that a lot of these markers, we just don't have clear clinical significance for what they mean. There's a lot of them that are popping up and making some noise when it comes to kind of elevated expression in some of our patients, but there's still, that is still kind of an evolving area. So you don't have to pay $1,000 for some cytokine test. You can do it for science, and you won't be charged, and you'll be contributing to really help tease out and really expand the knowledge so that we can get there, right? Get to that place where we can identify specific signatures of biomarkers.
So the visits are at main campus? Where do the patients go?
Yes, yes, they are at the main campus, and they are also at KKI for some parts of it. So the MRI part is at the Kennedy Krieger Institute, which is just down the street from us at Johns Hopkins. They'll also be doing some task that's going to be done at KKI. So it's basically to understand motivation and really tease out the lack of motivation that we see in some of our patients. And so there's some interesting parts of the protocol where they have to do a task to kind of help us tease out where that's coming from. Yeah.
So very comprehensive neuropsych assessment with MRI and then with a bunch of inflammatory markers in the blood. And so pretty impressive. Wonderful. Who sponsored the study?
I'm very excited because this group, I actually like Dr. Leah Rubin. She's a professor of neurology, and I like personally knew her. We were just talking about it in kind of our kids' play dates, and she's like, well, perfect. I just have it all set up, and we just have to, kind of go with that. And instead of doing HIV patients, that's been our main focus for I think 10 years now. We're going to incorporate that so we don't have to reinvent the wheel and use mechanisms that are already in place.
And who's sponsoring this?
Yes, the NIH is sponsoring it. Awesome. And we got funded in May, which was very exciting. And
you all ready to go? Like, should we start sending patients, or is the IRB still?
We started last week. Last week was our first visit. And this week we have 3 scheduled already. So we're looking at doing about 3 to 4 patients per week. Yeah, so we were funded at the end of May. So we're a little bit behind because we just got started recruiting. So we're kind of making efforts to reach.
That's actually quite fast compared to the way things happen on our campus. We have some studies cooking. They've been funded a long time ago. We still can't get through IRB. So, well, wonderful. Congratulations. I think it's really, really important work. We'll make sure we'll promote this and make sure that all of our patients know about your study. And thank you so much for coming back, and good luck with everything.
Thank you so much. And I really appreciate and trusting me with your patients, and to let them know of these opportunities if they're so called to participate in it. So thank you.
Great.